Some people think it's superficial, that you should be able to get used to your new body after you have been pregnant. But many people feel like they don't look like themselves, they don't feel like themselves after they've gone through a pregnancy. My name is Dr. Kat Karami. I'm board certified in regenerative medicine. And today I want to talk about mommy makeovers, non-surgical, non-invasive ways to regenerate the body after pregnancy and make it get closer to how it used to look like before. Our bodies change when we go through pregnancy. That goes without saying. People gain weight in their abdomen, they get loose skin, stretch marks. There's also changes that happen in the vaginal area leading to decreased sensation, painful intercourse, inability to hold the urine called stress urinary incontinence, losing urine when people laugh, cough, exercise. They don't feel like they can be as confident in their sexual interactions. There's not as much sensation, there's difficulty reaching climax. All of these changes can be addressed when we talk about mommy makeovers. In a consultation, I like to talk to the patient and see if they're a good candidate for non-surgical and non-invasive treatments. Sometimes there are just too many changes and I tell people they have to see a plastic surgeon. But the majority of people benefit from having regenerative treatments to help them recover from the changes that have happened after pregnancy. When I hear about people not feeling like themselves after pregnancy, I recommend that they come in for a consultation to see if they're a good candidate for the non-surgical, non-invasive regenerative treatments. Sometimes people come in and there's just too much looseness to the skin, too much skin that needs to be removed. And in that case, I tell them they need to see a plastic surgeon. But the majority of people will benefit from non-invasive ways of tightening their skin, taking away stretch marks, and attending to their intimate wellness. We restore function and then we maintain it. That's all that regenerative medicine is about. So I love the fact that it's natural, the fact that it's empowering your body to do its thing. It is really satisfying dealing with patients that want to get back to themselves, want to regain confidence, and also desire it in a natural way. And I love doing that for patients because after the treatment is done, once they've had the treatment, they're excited about being able to look at themselves in the mirror and recognize themselves once again and feel confident about who they are in their interpersonal relationships. Many people do want to get back to themselves. They have the changes that happen after pregnancy, but they don't know what's possible to achieve from a non-surgical treatment. Some people are afraid undergoing treatments thinking it's painful, that it's invasive. All I can say is that there are many different ways of regenerating the body and many different ways of making it look better. The best thing is to come in and to see if you're a good candidate for a non-invasive treatment. And in that consultation, you can find out what's possible, how does it feel, learn about what other patients have experienced. The majority of people that go through these procedures find it incredibly easy, that it's not painful, it's non-invasive, and it can be fit into their lifestyle.